Good morning. My name is Monica Bharel. I'm the Commissioner of the Massachusetts Department of Public Health and a primary care physician who has spent over 20 years in this area trying to work with my patients to get them what they need from a medical angle, but then noting that their social needs and the social determinants of their health far outweighed the capacity of my prescription to help them achieve health. I'm thrilled to be here with all of you today. I'll start by saying that often when I bring up, as many of you realize in your work, this issue of addressing the social determinants of health, we get told that it's hard to boil an ocean. And what I want to give you today is one example of a concrete way in which we in Massachusetts are addressing the social determinants of health with the levers that we have. So because I'm short on time and I'm very eager to tell you a lot of information, I'll give you the punchline first. So our model, people ask me all the time, how have we been able to be successful? And it's three things. One is a deliberate focus at the Department of Public Health on the social determinants of health. Second is using the levers that we already have within the Department of Public Health and the resources already going out to the community to help our healthcare systems change the way they look at their role in communities and a real focus on community conditions. So what's the deliberate focus on the social determinants of health? This is what I call our Massachusetts Department of Public Health house, if you will. When I started in 2015, we began using this as our framework for all of the work we do across the department. The vision and mission of our work remains the same. It's about access to health for all individuals. Health equity is embedded in the mission of the Department of Public Health. The foundation is the wonderful people that I get to work with every day who are passionate about this work and our many stakeholders. The three pillars in the middle is what we added as our framework. And it's, again, using existing data, so working smarter, not harder, using existing data at the Department of Public Health to highlight the social determinants of health, finding where the data disparities are, and then targeting with a laser focus our limited resources on those areas. The example that I want to give you is our Massachusetts Determination of Need program and how we used this lever. So I mentioned levers. So briefly, the Determination of Need program, in many places called the CON, not the DON, Certificate of Need, really works. It's in law and it's regulated by the Department of Public Health so that investments that are made for improvements in the healthcare system must go through a determination of need and public health value at the Department of Public Health. Really importantly, there is money set aside, 5% of the capital expenditures, that must go towards community health investments. And in 2017, when we did a regulation reform, we reformed the regulation so that community health investment, or CHI money, is now, through regulation, directed upstream to the social determinants of health. And we codified that in our regulations, as well as codifying how communities must be engaged. I'll talk about that for a minute. So first, for the first time, we codified in regulations that these are our health priorities. So the hexagons around the outsides are the social determinants of health. In this audience, I don't have to go through and explain each one of them. But it's the first time that we at the department said, instead, in addition to our work with specific diseases and metrics that we follow, we know that all of those are affected by these social determinants of health. And this is where we want the healthcare community investments to go. When looking at health outcomes, we looked at our data across the department and what individuals die early from, so high mortality and high morbidity rates, and came up with the highest areas of inequity. And those are what you see in the middle. And that is mental health and wellness, homelessness and housing stability, substance use disorder, and preventing chronic disease. So now when a health system in Massachusetts puts these community health investments into the community, they must be in one of these areas unless they in concert with the community decides that there needs to be something else done. And all of them are choosing things within this area. Another important piece of this is that there's a focus on health equity, but also racial equity. So we talk about, when we speak with the health systems, they must break down their data by race and ethnicity. They must talk about structural racism and community-based efforts to address those. I mentioned that we define community engagement, and if you look at that small circle, you'll see that's our determination of need process, and within that, we have the community health investments. And those are sporadic. It's whenever a hospital system needs to make an upgrade. The larger circle is the one you're all familiar with, and those are our community health improvement plans, right, that every non-for-profit has to do every 3 years. We deliberately hooked in our determination of need process into the community health improvement plan so that we could also affect change in the way that that is done. And so the determination of need process is now affecting that. And in fact, our Attorney General has also taken on these health priorities as something for each nonprofit to report on at the Attorney General level as well. So really expanding our reach in those areas. And I'll end with a short example of an early success to make it very concrete. Most of our determination, a vast majority of our determination of need funding goes to Boston. And in Boston, this is an example of Boston Medical Center, where for the first time, their community health investments are being invested in capital dollars for housing and loan repayment, which you heard is an evidence-based way to address these issues, as well as a zero-interest loan for a grocery store, because this area is an area of food insecurity. All 13 hospitals in Boston have now come together for the first time to do their community health needs assessment together, so we don't have this duplication and waste of resources. And in fact, 2 hospitals, Boston's Children's Hospital and Brigham and Women's, have also chosen to invest in this same project. So it's really enhancing the power of the project. So I'll stop there and look forward to our discussion. Thank you.